My body must be broken. God must be punishing me for something. It must be my fault. These are some of the things that I have heard women say after having a miscarriage. These are some of the things that you'll see on like anonymous pages on Reddit. These are some of the things that I'm sure a lot of women who has had a miscarriage have thought about themselves. Hi, my name is Adetutu. I am a board-certified women's health nurse practitioner, and today we are going to talk about miscarriage. My goal is to make you feel seen and heard and answer some of your questions that you may have about miscarriage. Let's dive in. So miscarriage is a sudden loss less than 20 weeks. It's actually very common. 1 in 10 women will actually have a miscarriage in their lifetime. 1 in 4 known pregnancies will end in a miscarriage. And actually, 23 million miscarriages occur every year worldwide. So it's so common. So how come it seems like it's rare and people don't talk about it? Well, unfortunately, it's because of the taboo that surrounds miscarriage. A lot of women blame themselves and they think that other people will blame them too. Well, the first thing I really want to clear up is you did not cause this. Which leads us to what actually causes a miscarriage. So we're going to talk first about chromosomal abnormalities. Now, this is the most common causes of miscarriage. It actually accounts for 50 to 60% of pregnancy losses in the first trimester. Okay, think of chromosomes as puzzles. So when a piece of that puzzle does not fit, sometimes your body will just cause the pregnancy to not continue. And that accounts for 50 to 60% of miscarriages. Now, what are some other factors that can cause a miscarriage? Let's dive into that a little bit. So things such as diabetes, having uncontrolled blood sugar, things such as having a high BMI. Having a BMI greater than 25 has actually been linked to 70% increase of having a miscarriage. So that's pretty high. Certain untreated infections, so sexually transmitted infections such as syphilis, can greatly cause a miscarriage. Chronic stress, not acute stress, but chronic stress. Thyroid disorders, so hyper or hypothyroidism, actually doubles a woman's risk of having a miscarriage. And other risk factors are poorly controlled hypertension, having structural problems with your uterus or cervix, so such as fibroids, having blood clotting disorders or autoimmune disorders such as lupus. Now, let's talk about age and how age is related to miscarriage. So first, we're going to talk about women. Now, in a huge study that was done of over 421,000 pregnancies, it studied and it correlated how age increased a woman's risk of miscarriage. Now, what did it find? It found that 25 to 29 was pretty much the lowest risk, okay? Now, the risk of miscarriage actually increased with women who were over the age of 40. It increased by 33%. And over the age of 45, shot up to 57%. Now, an interesting thing that I found was women who were younger than 20 and women who were between 35 and 39 had the same exact risk of having a miscarriage. So, well, what about men? Well, sperm quality actually matters too when it comes to miscarriage. Shocking, right? We are actually finding out more and more simply because we're doing more research on men's health that a man's age and a man's health can actually cause an increase or decrease in a woman's risk of having a miscarriage. Okay, now I'm just going to talk about a little study that was not a little study, actually, a big study that was done of almost 1 million pregnancies. Now, what this study found was that men who were of advanced age, their partner had an increased risk of having a miscarriage, and then men who had any of these metabolic syndromes. So metabolic syndromes, so having things such as having a high blood pressure or high blood sugar or high cholesterol, or even having excess belly fat. Having any of those increase a woman's risk of having a miscarriage. Not having any of those cause a decrease of a woman's chance of having a miscarriage. So that was an interesting, huge study that pretty much confirmed that men's health matters too. Let's clear up some myths about miscarriage. What does not cause a miscarriage? Okay, so first is exercise. Lifting heavy weights, running a marathon, doing regular physical exercises does not increase a woman's risk of having a miscarriage. Another big one, sex. having maybe vigorous sex or having orgasms and those type of things, they have not been linked to a miscarriage. Caffeine, however, drinking moderate caffeine is not linked to miscarriage, but drinking more than that, that's another conversation. Flying is not linked to miscarriage. Morning sickness, meaning vomiting, having things such as hyperemesis gravidarum, has not been linked to a miscarriage. As a matter of fact, having morning sickness has actually been linked to a healthy pregnancy. So those are some of the myths that I really wanted to debunk. Oh, and also using birth control has not been linked to a miscarriage. However, getting pregnant with an IUD and keeping the IUD in, that's what's been linked to a miscarriage. Okay, so how does one know if they're having a miscarriage? So we're just going to talk about some of the most common symptoms. So one of them, as you can guess, is bleeding, right? So heavy bleeding, heavier bleeding more than a period, and sometimes it can have a clot. Cramps that are more than a regular period. Low back pain, that's another common one. And then a sudden decrease in pregnancy symptoms. So you just notice that, all of a sudden your fatigue is significantly less and your breast tenderness is no longer there and things like that. So those are some of the symptoms that a lot of women say that they experience if they're having a miscarriage. So if you're having any of these symptoms, what can be done to confirm if you're having a miscarriage? Well, a few things can be done. An ultrasound can be done and a blood test level to check whether your pregnancy hormones are decreasing. So then after that, if you are having a miscarriage, what happens next? Now, unfortunately, once a miscarriage is happening, it can't be stopped. But there are options that you can do to manage a miscarriage. So one of them is just allowing it to pass naturally on its own. Your healthcare provider can give you medication to help you with the pain and discomfort. They can also give you a medication that can help the tissue pass quickly if you just want to get it over with, essentially. And then a procedure where the tissue can be removed, called a DNC. So that can be done as well. Now, the decision on which one to choose is up to you and it's up to your health. So you and your healthcare provider can decide. A lot of times it's a personal choice and essentially what's best for you. So you may be wondering, can you prevent future miscarriages? Now, as we've already discussed, miscarriages cannot be prevented, right? But what you can do is do your best to keep your body at its best, right? And how you can do that is doing things such as exercising, eating healthy, keeping your body at a healthy weight, stopping smoking, stopping alcohol, taking prenatal vitamins with folic acid. Folic acid is very good for baby's brain and spine. Managing chronic conditions like thyroid disorders or diabetes or hypertension, managing that with your primary care doctor, making sure that you're staying on top of your medications. And then also doing your best to eliminate stress. Doing your best to eliminate it. I know it sounds easier said than done, but try your hardest not to worry. Now, lastly, loss is hard. And no matter what society says, miscarriage is just as heavy and just as big of a loss as any other loss. Grieving is very natural. However you choose to do that is your right. Now, I do hope you don't do it alone. So it's important for you to find someone to talk to, a friend, partner, a counselor. There are lots of groups. Facebook is very great for niches. So you can quite literally just type in, people who have dealt with pregnancy loss, and hopefully you're able to find somebody that you can connect with because you deserve to not do this alone. And when you are ready to try again, know that 87% of people who have had a miscarriage in the past go on to have healthy pregnancies. And you can too. Now, if this video was helpful, I do want you to share with somebody that you think it can help. And as always, don't forget to comment, like, and subscribe for more on women's health. Thank you so very much for watching. I do hope you take care of yourself. You take care.